Make sure we are getting medical and scientific advice or information from properly credentialed people. Do not take medical advice from politicians. Do not take medical advice from anybody for that matter that is not properly trained. People spend years and a lot of money to go to school, to be trained, to be educated, to get this knowledge, to share it so we can help our communities. Medicine is always evolving and it's always good to question. That's the point of science, is to question. You see something that's not right, you question, you work it out, you do your research, you find out what the right thing to do is. Questioning is not the problem. It's when you give information, health information based on your own personal opinion that can actually cause harm to people. That's when it becomes a little tricky. So, hi everybody, my name is Anastasia and welcome to my channel. So, I'm going to go straight to the point. I'm sure we've all heard and seen on the news, on the radio, on social media this week about acetaminophen, Tylenol, and whether, it's safe to take during pregnancy or not. There's been people saying that taking Tylenol whilst pregnant can lead to your child being diagnosed with autism when they are born. So, what I want to say is that make sure we are getting medical and scientific advice or information from properly credentialed people. Do not take medical advice from politicians. Do not take medical advice from anybody for that matter that is not properly trained. People spend years and a lot of money to go to school, to be trained, to be educated, to get this knowledge, to share it so we can help our communities. When it comes to Tylenol and whether it's safe to take when you're pregnant or not, it's not black or white, it's not blue or red. There's a lot of nuances involved. And that's why it's best to get the information from your OBGYN, somebody that knows you, that's been with you throughout the pregnancy, knows your medical history, and can best advise you. We always check, is it beneficial to take the medication, or is it better for you not to take it? Is it going to cause harm if you take it, or is it better for you not to take it and deal with whatever you're dealing with? What I would say is that, especially Black women, when we complain of pain in medical settings, and this is not me saying it, there's been a lot of data that says that Black women, when we complain of pain in medical settings, we are not taken seriously. It's always, there's this perception that Black women can take pain high. Our pain threshold is higher than, other ethnicity. So a lot of medical professionals don't take it seriously. So I will hate for women, especially Black women, to suffer when they are pregnant and deal with pain that they don't need to, because they've been told to, suck it up, tough it up, and just deal with it. No, there are things that we can do to manage. And in fact, the two main reasons why women take Tylenol when they're pregnant is either they have pain or they have fever. And according to science and based on data, having pain or having fever has a higher chance of causing your baby in your stomach to have neural tube defect or premature birth or premature death. So it's not the Tylenol that is causing your child to have medical conditions such as autism when they are born, but rather, what made you take the Tylenol? Did you have a fever, or were you in pain, or why did you feel like you needed to take medication? So the problem is what could lead to the medical condition and not the Tylenol. And as I'm recording this video, September 2025, there's been no data, there's been no causal data found between pregnant people taking Tylenol when they're pregnant and a baby or a child being born and being diagnosed with autism. There are very few pain medications that you can take when you're pregnant, and Tylenol is one of them. It's been studied for many, many years. There's been credible research done. ACOG, American Gynecological Association, has come out and said that, it's safe to take Tylenol when pregnant. The pharmaceutical company, the people that make acetaminophen or Tylenol, I use them interchangeably during this video. They have also come out and said that it's safe to take it when you are pregnant. So please do not suffer in silence and think that, taking Tylenol because you have pain or you have fever can lead to your child being autistic. Rather, the pain or the fever that you're having will have a greater effect on their health. So seek help for that and not blame the Tylenol for any medical conditions that your child might have. However, there have been data, there have been research that found that taking Tylenol on a regular basis can lead to endocrine disorders. And these are pharmacological and physiological links that has been found that taking Tylenol on a regular basis can lead to endocrine disruptors and oxidative stress. So maybe, and this is just a maybe, these might be the cause of any other health condition that your child might have, but not necessarily because you took Tylenol. So, 60% of pregnant people in the whole country take Tylenol at some point during pregnancy, and there's only 3% of kids that are diagnosed with autism. So, if 60% of people are taking it and only 3 people are coming out with this diagnosis, then there isn't a causal link that taking Tylenol can lead to your child being autistic. I'm a family health practitioner. Healthcare professionals, as scientists, we need to be humble enough to know that we don't know everything. There's still more education than we need. We need to do more research. We need to be open with our patients and let them know what we do know and what we don't know. Sometimes it's important to tell a patient, I don't know this. Let me do more research and I'll get back to you. It just builds a better relationship with the patients. They're able to trust you more. So let them know what you do know and what you don't know. Let's not be, egotistical and just wear our white coats and feel like, nobody can challenge us. We have to be humble. We have to learn. Science is forever evolving. There's more studies that we need to do. And so let us all be open. Please stay safe out there. Get your information from properly sourced people or places. And take care of yourself, and I'll talk to you soon. Bye.